A doctor signs a death certificate. Cause of death? Cardiac arrest. The family buries the body. Killer walks free. And the poison? It was never found. Today, we are looking at 7 cases where poisons so sophisticated, so perfectly chosen, that trained doctors, looking directly at the body, had no idea a murder had even occurred. These are real cases, documented in medical journals and court records, and they changed forensic science forever. A death certificate is supposed to be the final word, the medical truth of how a person died. But for decades, and in some cases even today, certain substances could slip right past a standard autopsy. No visible trauma, no suspicious findings, just a body that looked like it simply stopped working. Here are 7 of the most documented cases where that happened, and what they eventually revealed about the limits of forensic medicine. Succinylcholine, a drug used every day in operating rooms to temporarily paralyze patients during surgery. In clinical doses, it is life-saving, but in an overdose, it stops every muscle in the body, including the diaphragm. What makes succinylcholine particularly dangerous from a forensic standpoint is what happens after death. The body's own enzymes break it down into succinic acid and choline, both naturally occurring substances found in normal human tissue. By the time a pathologist examines the body, the compound is essentially gone. In 1966, physician Carl Coppolino was charged with the murder of his wife using exactly this drug. The case hinged on whether laboratory techniques had advanced far enough to detect the metabolites in decomposed tissue. It was one of the first times forensic toxicology was genuinely tested in a courtroom. Ricin. Derived from the castor bean plant, ricin works by entering cells and permanently shutting down protein synthesis. There is no antidote. It causes progressive multi-organ failure over 36 to 72 hours, and in small doses, it can look almost identical to a severe systemic infection or unexplained sepsis. In 1978, Georgy Markov, a Bulgarian dissident living in London, was stabbed in the leg with a modified umbrella on Waterloo Bridge. He developed a fever, his white cell count climbed, and 3 days later, he was dead. The initial assumption was severe infection. It was only during autopsy that a tiny platinum pellet, 1.7 millimeters in diameter, drilled with holes, was found embedded in his calf. The holes had contained ricin. Without that pellet, the case would have been filed as death by unknown infection. It was a mechanical discovery that revealed a chemical crime.
Arsenic. For most of the 19th century, arsenic trioxide, then sold openly in pharmacies as rat poison, was known as inheritance powder across Europe. Chronic low-dose arsenic poisoning produces symptoms virtually indistinguishable from cholera or gastroenteritis: vomiting, diarrhea, progressive weakness, and finally, cardiovascular collapse. Doctors of the era saw these symptoms constantly from natural disease. They had no way to distinguish them. The Marsh test, developed in 1836, changed everything. For the first time, arsenic could be chemically detected in tissue samples. The case of Mary Ann Cotton, a Victorian-era woman suspected of poisoning up to 21 family members, including her own children, only became prosecutable because arsenic was finally detectable. Before that test existed, every death had been attributed to natural illness.
Cotton was hanged in 1873. But the more disturbing question forensic historians raise is this: how many identical deaths happened before 1836 and were simply signed off as gastric fever? Insulin. In a diabetic patient, an insulin overdose produces hypoglycemia, dangerously low blood sugar. The brain is deprived of glucose and shuts down. In someone found unconscious at home, particularly an elderly patient, this looks exactly like a natural death from diabetic complications or cardiac arrest. The difficulty is that insulin degrades rapidly after death, and hypoglycemia itself leaves no visible anatomical finding at autopsy. The body simply looks like it's stopped. Forensic detection requires taking vitreous humor, the fluid from the eye, within a specific postmortem window and running specialist assays that most standard autopsy protocols do not include unless foul play is already suspected. The Beverly Allitt case in the UK, a nurse convicted of murdering 4 children in her ward in 1991, was only uncovered when a pattern of unexplained cardiac arrests in otherwise stable patients triggered an internal investigation. Individually, each death had a plausible medical explanation. The pattern was what revealed the poison. Ethylene glycol, the active ingredient in automotive antifreeze. It is sweet-tasting, colorless, and in the early stages of toxicity, produces symptoms that closely mimic severe alcohol intoxication: slurred speech, disorientation, vomiting. Without a high index of suspicion, an emergency physician seeing a confused, unwell patient might reasonably assume alcohol poisoning and provide supportive care. The problem is that as ethylene glycol is metabolized, it produces oxalic acid, which crystallizes in the kidneys. Within 24 to 72 hours, it causes acute renal failure. By the time the mechanism becomes clear, the window for treatment, which requires fomepizole or ethanol, has often closed. In the documented case of Lynn Turner in Georgia, USA, convicted in 2004, her husband and later her boyfriend both died of what was initially recorded as cardiac and natural causes. The link was only established because a pathologist reviewing the second death recognized calcium oxalate crystals in the kidney tissue during a re-examination, a finding entirely consistent with ethylene glycol poisoning that had been missed the first time. Digoxin, derived from the foxglove plant and still used today to treat heart failure and arrhythmias. Digoxin at toxic levels causes fatal cardiac arrhythmias. In an elderly patient who already has a documented heart condition and is already prescribed the drug, a digoxin-induced death is extraordinarily difficult to distinguish from natural cardiac death. Forensically, the challenge is that digoxin distributes differently in tissues after death, a phenomenon called post-mortem redistribution. Blood levels taken at autopsy may be dramatically different from what they were at the time of death, making interpretation unreliable without specialist knowledge. The case of Charles Cullen, an American nurse who confessed to killing between 40 and 400 patients across 9 hospitals over 16 years, involved digoxin as one of his primary agents. Hospitals repeatedly noticed unexplained deaths, but attributed them to the already compromised health of ICU patients. He was only caught when a hospital began monitoring medication dispensing irregularities rather than mortality patterns. Polonium-210. This is arguably the most extraordinary case of forensic evasion in modern history. not because the substance was unknown, but because detecting it required equipment that virtually no forensic laboratory on Earth routinely uses. In November 2006, Alexander Litvinenko, a former Russian intelligence officer living in London, fell severely ill. His symptoms were confusing: severe gastrointestinal distress, bone marrow suppression, hair loss, and progressive multi-organ failure. Physicians considered thallium poisoning, then other heavy metals. Standard toxicology screens found nothing. It was only when a sample of his urine was sent to the UK Atomic Weapons Establishment that the answer emerged: polonium-210, a radioactive isotope that emits alpha particles. It is undetectable by standard gamma radiation detectors. It produces no external radiation that would set off a Geiger counter. It requires specialist alpha spectroscopy equipment to identify.
Litvinenko died 23 days after being poisoned. The cause of death on his initial medical records was acute radiation syndrome, a diagnosis that required entirely novel forensic methodology to establish. A British public inquiry concluded in 2016 that the operation was probably approved by senior Russian state officials.
Seven poisons. 7 cases where the body gave no obvious answers. And in every single one, it was either a technological breakthrough, a statistical pattern, or a specialist with the right knowledge who finally uncovered the truth. What these cases reveal is something important about the limits of medicine. A death certificate is only as accurate as the tools and knowledge available to the physician who signs it. Forensic science exists precisely to fill the gap between what medicine can see and what actually happened. As detection methods improve, and they do improve, cold cases are reopened, historical deaths are re-examined, and occasionally, what was filed as natural causes becomes something entirely else. If you found this case analysis useful, the next video covers 5 autopsies that fundamentally changed how courts evaluate medical evidence. It is worth watching. I am your narrator. This has been Forensic Files, MD.